Polycystic ovary syndrome is also called PCOS. It is a hormonal imbalance that occurs when the ovaries create excess hormones. This causes the reproductive hormones to become imbalanced, and the ovaries begins to produce unusually high levels of hormones called androgens. As a result, people with PCOS often have irregular menstrual cycles, missed periods, and unpredictable ovulation. Small follicle cysts may be visible on the ovaries during ultrasound due to lack of ovulation. PCOS can cause infertility and other health conditions. Signs of polycystic ovarian syndrome includes 1. Irregular periods. Abnormal menstruation involves missing periods or not having a period at all. It may also involve heavy bleeding during periods. 2. Abnormal hair growth. You may grow excess facial hair or experience heavy hair growth on your arms, chest, and abdomen. This affects up to 70% of people with polycystic ovarian syndrome. 3. Acne. Polycystic ovarian syndrome can cause acne, especially on your back, chest, and face. This acne may continue past your teenage years and may be difficult to treat. 4. Obesity. Between 40% and 80% of people with polycystic ovarian syndrome have obesity and have trouble maintaining a weight that's healthy for them. 5. Darkening of the skin. You may get patches of dark skin, especially in the folds of your neck, armpits, groin, and under your breasts. This is known as acanthosis nigricans. 6. Cysts. Many people with polycystic ovarian syndrome have ovaries that appear larger or with many follicles. 7. Skin tags. Skin tags are little flaps of extra skin. They're often found in your armpits or on your neck. 8. Thinning hair. People with polycystic ovarian syndrome may lose patches of hair on their head or start to bald. 9. Infertility. Polycystic ovarian syndrome is the most common cause of infertility. Not ovulating regularly or frequently can result in not being able to conceive. It's also possible to have polycystic ovarian syndrome and not have any symptoms. Many people don't even realize they have the condition until they have trouble getting pregnant or are gaining weight for unknown reasons. It's also possible to have mild polycystic ovarian syndrome where the symptoms aren't severe enough for you to notice. Causes of polycystic ovarian syndrome. 1. Higher levels of male hormones called androgens. High androgen levels prevent the ovaries from releasing eggs, which causes irregular menstrual cycles, irregular ovulation, and can also cause small fluid-filled sacs to develop on the ovaries. High androgen also causes acne and excess hair growth in women. 2. Insulin resistance. An increase in insulin levels causes your ovaries to make and release male hormones called androgens. This male hormones suppress ovulation and contribute to other symptoms of polycystic ovarian syndrome. Insulin resistance means your body doesn't process insulin correctly, leading to high glucose levels in your blood. Not all individuals with insulin resistance have elevated glucose or diabetes, but insulin resistance can lead to diabetes. An elevated insulin level, even if your blood glucose is normal, can indicate insulin resistance. 3. Low-grade inflammation. People with polycystic ovarian syndrome tend to have chronic low-grade inflammation. Prevention of polycystic ovarian syndrome. There's no proven way to prevent PCOS, but you can take small steps to reduce your symptoms. For example, eating nutritious foods, exercising regularly, and managing a healthy weight for your body can help you avoid the effects of polycystic ovarian syndrome. Frequently asked questions. 1. Can PCOS cause a miscarriage? Having PCOS may increase your risk for certain pregnancy complications, although most women with PCOS are able to successfully carry a pregnancy. Other complications of PCOS related to pregnancy include increased risk of gestational diabetes, preeclampsia, and high blood pressure. Preterm birth or C-section, delivery due to obesity, diabetes, or high blood pressure. Does PCOS ever go away? While there isn't a cure for PCOS, your healthcare provider can help you manage your symptoms. The effects of PCOS may change over time so that you become less aware of the condition. However, there isn't a treatment that permanently cures it. Can I get pregnant if I have PCOS? Yes, you can get pregnant if you have PCOS. PCOS can make it hard to conceive while also increasing your risk for certain pregnancy complications, but many people with PCOS do get pregnant on their own. Your healthcare provider will work with you to develop a treatment plan to help you ovulate. Your treatment plan could include medication or assisted reproductive technologies like in vitro fertilization (IVF). Does PCOS put me at risk for other health conditions? Research shows PCOS may raise your risk for several health conditions, including diabetes, high blood pressure, cardiovascular disease, endometrial hyperplasia, endometrial cancer, sleep disorders such as sleep apnea, depression and anxiety. Talk to your healthcare provider to make sure you understand your risk for developing these conditions. Is PCOS genetic? Researchers are learning more about the causes of PCOS. However, some evidence shows PCOS has a genetic or hereditary component. This means if your biological parent has PCOS, you may be more likely to have it too. If you have any question or find this video helpful, kindly drop a comment in the comment section.
If you find this video helpful, kindly like, subscribe and turn on the notification bell to get more updates from us.